right, good morning, everyone. I'm going to get us started while hopefully we have more people joining throughout this morning. So thank you all for being here, and good morning, good afternoon, good evening. I know a few of you are from different parts of the world, so thank you for joining today. My name is Haley Schramm. I am a WASH research assistant at Global Water 2020. And I am happy to welcome you to the Environmental Cleaning and Cleaners Community of Practice workshop. I have been working with cleaners in healthcare facilities for some time, and I'm really excited for today to hear from you all and to engage in the discussion later today. Before we begin, and as people are slowly joining the meeting, I'd like to talk a little bit about the logistics of the workshop and how it will function. So in a few moments, I will be introducing Dr. Wendy Graham, who will kind of kick us off and give some opening remarks. But before that, we will be having a workshop style discussion today. So following her remarks, you all will be divided into two different breakout groups. Each of those groups will have a facilitator who will guide you through two main questions, and then a rapporteur who will be a master note taker. The breakout groups will last for approximately 60 minutes. You'll have 25 minutes per question where you will discuss and engage as a group. And then from there, the breakout groups, everyone will return back to the main session, and the rapporteurs who have been taking notes will give a quick highlight to the rest of the group, essentially just digesting what each group discussed. During these breakout groups, we really encourage everyone to use their videos as much as your bandwidth allows. We are hoping that the discussion is informal and engaging and interactive, so please don't hesitate to speak up or share experiences as you can. Following the session today, most likely in the next 1 to 2 days, you'll receive a follow-up email that will contain a document summarizing the event today, summarizing what each breakout group discussed, as well as a link to the recording and any documents or resources that were shared during the workshops today. So now, not to waste any more time, I'm going to turn it over to Dr. Wendy Graham, who will be giving some opening remarks. Sorry, I'm letting some people in the waiting room. Dr. Wendy Graham has been directly involved with the training of cleaners for multiple years now. She previously worked with the Soapbox Collaborative, which was an NGO that opened in 2012 and closed its doors a few years ago in 2019. She's known for developing the Teach Clean package, among a few other research objectives. She currently is a professor of obstetrics and epidemiology at the London School of Hygiene and Tropical Medicine, and she has a special interest in the prevention of healthcare-associated infections in mothers and newborns, and has been a huge advocate for cleaners and environmental cleaning. She's known by everyone, or at least everyone at Global Water 2020, as Professor Mop and Bucket. Wendy, thank you so much for being here today, and I'm going to hand it over to you.
Thank you very much, Haley. I don't think I'm ever going to live that down, am I? The mop and bucket.
No, definitely not.
It follows me everywhere. I hope you can see my opening slide.
Yep.
Yes, you can. Great. So yes, mops and buckets and counterfeit bleach follow me throughout the world, it seems. So I'm really stuck with the Professor Mop to Bucket title. But thank you very much, Haley, and thank you very much the Global Water 2020 for setting up this meeting and giving me this chance to say a few opening words. And welcome to all the what I call clean advocates that are sitting around the world and joining us this afternoon. So welcome. I think I'm going to speak for about 10 minutes, and I think in some ways I could stop at this first slide because it sort of summarizes my main message, which is indeed that we have come a huge way over a relatively short period of time, particularly in terms of global advocacy and putting the whole idea of environmental cleaning on the map, particularly perhaps at a global level. But I think, and I hope you would agree, that we really do need to focus our attention more to the front line. And in some ways, I've used the mop and buckets and the bleach on the left-hand side of my slide here, just to point out that at that front line, that's the level, that's the point at which patient outcomes and indeed health worker outcomes get better as a consequence of improved environmental cleaning and other activities. But that's really where our goal is. And at the front line, there are some very nitty-gritty things that include things like mops and buckets and the issue of cleaning fluids. And I think now that we have it on the map, I think those frontline issues need to have more attention. So what I hope I'll do in these 10 minutes is give you some food for thought that we're going to pick up on in the group discussions. So we've come a long way, and we've come a very long way if you look at things, and I hope it's not going to start doing this, because sometimes this advancing of slides is up. Oh, there we go. We've come a very long way. Environmental hygiene indeed goes back a very long way. This is a picture taken from the Glasgow Royal Maternity Hospital in the turn of the century, when we really didn't understand about many aspects of transmission of infections. But right from the very beginning, the concern for the environment in terms of hygiene really fell to nurses and midwives. And it's a coincidence, it's an International Midwives Day a little while ago, and International Nurses Day very recently. And I think it's really important to acknowledge the importance of the nursing profession and midwifery profession in the whole area of infection prevention control, which goes back a very, very long way. And the famous nurses, including Florence Nightingale. If anyone has never read Notes on Nursing, I strongly recommend it, by Florence Nightingale. And it's eerie, her comments about ventilation, about hygiene, a long, long while ago, even before many of the current understandings of transmission. So nursing midwifery has a long history of work in this area, but of course some of our current understanding is much, much more recent. But for myself and my colleagues at the London School, we came to this because of our concern with hygiene on maternity units. And as Hayley mentioned, we started something called the Soapbox Collaborative back in 2012, when we were really concerned with healthcare associated infections. But out of that, we discovered a number of areas that had really very little attention. And environmental cleaning was one of them, and in particular, the cleaners. We were amazed at how the fact that we wanted to speak with them and we understand what they were doing. There was great surprise amongst the rest of the research team and certainly the other healthcare providers. But we found this huge hole, both in the way cleaners were regarded, but also the way they were trained in their basic knowledge. And out of that, as Hayley mentions, some of you know, the Teach Clean participatory training package developed or released in 2018 and has been in great demand, particularly in the COVID era, for use for training cleaners, so people working at the front line. So this interest in our interest started with maternity units, and it's quite interesting because if you look now, a lot of the conversation about hygiene is really being taken forward by thinking about the maternity unit. And I do think, of course, that's important, but I do think we need to think about other areas more as well, including special areas like the OR, the operating room, and the NICUs. So lots of stuff being done on maternity units, but of course, at the same time as what we were doing, many others were working. I mean, of course, there was the 2018 launch of the International Decade for Water for Sustainable Development, and a specific flag from the UN Secretary General about the problem of water wash in healthcare facilities. And then a whole series of things following on. And of course, it's no coincidence, I suppose, that we're having this meeting just a few days before the World Health Assembly next week. In Geneva, will be a remote meeting, obviously, for obvious reasons. But in looking back at that 2019 moment, it's quite interesting because I've searched many high-level documents and the word cleaning actually does appear in the resolution document, but cleaning is often just not mentioned. And I think sometimes we have to be very specific about the use of that word. Environmental hygiene or environmental cleaning, but cleaning and cleaners really needs to be the narrative that we keep reminding people about. Of course, at that event, which there were side events to support the resolution, WaterAid, UNICEF, WHO, which led to the famous, or rather infamous, golden mop moment, which happened because of speaking about cleaning at that event, and the DG unexpectedly came in the room, and without even thinking, and I don't know where that came from, I handed him a mop, the golden mop, really is a call to the Director General to also endorse this issue that the cleaners are part of the health workforce and cleaning is something we need to strengthen. Other opportunities going on, I mean, out of the resolution, of course, there was the adding of 2 key indicators to the JMP about environmental cleaning, on cleaning protocols and on whether training had been received, really important development. And other areas of development, the core components around IPC, evidence about the importance of participatory training of health workers, the inclusion of actually a chapter on cleaning in a document on AMR. And of course, the very important CDC and ICANN best practices. And I know that Maggie Montgomery is here with us today. So I'm sure Maggie will give us a little bit of an update on that. So the other side, so what I've talked about is the supply side of the greater interest and awareness of cleaning. But I think we also need to promote and think about the demand side. And one of the things that I think was incredibly helpful was this, the outcomes of this big survey that was reporting back in 2019, an inquiry amongst 1.2 million women. And many of you all know that hygiene, the issues of disgusting conditions, as this quote mentions, really came up and shocked a lot of people. That was the #1 concern that women in many, many different countries, 114 countries, expressed. That demand side, I don't see so much. I see much around maternity services asking about women's views. I don't know in other clinical areas if there has also other patients in other clinical areas have expressed this concern for poor hygiene as well. But we do need to recognize that addressing this, there's the supply side, the training, the cleaning equipment, etc. There's also what we can do to build on the demand side, which is the unacceptability of unhygienic environments. And I think that's really important. The latest JMP, the update report, came out in 2020. I'm sorry, this slide is probably far too small for anyone to see, but you can have the slides afterwards. But I just want to draw your attention to the final column, which is talking about the data reported back on environmental cleaning, the 2 indicators, cleaning protocols and training of cleaners. And the conclusion is that this is around the world. So this was data for 243 countries, areas and territories, and only 12 actually reported some data. So although we've got the indicators there, we need to be sure that this commitment to reporting on this and following through on actions is more than just across something like 12 countries. But of course, the global pandemic has come along since then and really turned the world upside down. So along came COVID. And if there was anything that was really going to propel hygiene and cleaning to the front of many people in the general public and in healthcare facilities, it of course was COVID-19, the pandemic. And this is a slide taken from a presentation given last October on Thank Your Cleaner Day. It has undoubtedly changed the dynamic and awareness of cleaning. This is a picture taken from the hospital in which I work, and I've been on the COVID ward. The whole, myself seeing deep clean being undertaken really made me think a lot about the constraints that we face in low middle income countries. We need to build on experiences around COVID-19 and the importance of cleaning. What COVID-19 also did with the data, it also showed, and this is a risk assessment showing you wages, how individuals are paid relative to the occupational risks they carry out. And it showed that nursing auxiliaries and cleaners and domestics really were facing significant risks, and it included infection-related risks relative to the salary that they receive, their reimbursement. And also it reminded us, this COVID-19, is that we do need to remember the infrastructure. You cannot clean adequately in the complete absence of water, nor can you, of course, even with hand gel. We do need water in healthcare facilities, so we do need to recognise that piece of the jigsaw as well. Thanks to Global Water 2020, they initiated this Thank Your Cleaner Day last October. So again, high level attention to cleaning in the wake of going on during the COVID-19 pandemic, and other opportunities. So these are very recent. So what I see is that countries are updating their national standards. So just 2 weeks ago, the NHS in the UK updated its national standards on cleanliness. These have actually proved to be quite controversial here in the United Kingdom. Interestingly, I never thought I'd see the day where cleaning standards were seen as so controversial, but that's what's going on now in the UK. A really interesting set of documents. And importantly, WHO has used with our permission, of course, the Teach Clean package, and adopted it and built their own training package, which will be released quite soon. And we have Stephen Nurse-Findlay, Julie Storr and Claire Kilpatrick, I hope, in this meeting, who were the initiators of this work and could answer some more queries. So once that WHO version is released, we will withdraw the old Teach Clean because we don't want to cause confusion. That was released in 2018, and we will carry on our work on cleaning in other areas because obviously the WHO package is the one that we should be emphasizing. There is accumulating country experience. I would like to think that this community of practice would find a way for us to have a repository about cleaning experiences. I know about quite a lot, some particularly with WaterAid that we've been involved in. This one on the left is with Myanmar. And also there is room for research. There is room still to do things better, differently, more effectively. We're doing a trial with Africa CDC in Nigeria at the moment, looking at a trial of electrolyzed water as a cleaning fluid, which is cheaper than the other fluids that are typically used and not so prone to over dilution, and work on using surface microbiology. My final slide, I'm sorry, I don't have my clock right in front of me. I do apologize if I've overgone my 10 minutes. I do think that to go right back to this issue of nitty gritty, of course, we do need global advocacy. We do need to have this on the map, and a lot has been achieved. But we do need to get also now back down to nitty gritty, to the front line. And I think that we, as I said, I've mentioned this, the importance of infrastructure, supplies and equipment. We need to scale up our training. It cannot be a drop in the ocean. We need to think about digital training. And in Cambodia with WaterAid, WaterAid is working with us on possibilities there. We need still to push. I still see cleaners not included as members of the health workforce. They don't have access to issues of CPD. Their contracts are often very weak, and I think there is a scope for accrediting cleaners in the way that we did. Things changed enormously in the midwifery profession when it became a profession. I think we need to think about the same for cleaning, not just a piece of paper, but truly the training to make this a profession. We need more data. And there's several areas of research and development, whether it's budgeting tools to make sure there's not shortfalls of equipment, training in different situations. We've done work with the Red Cross and training in humanitarian scenarios, use of simple techniques like gel dots, which is a way of checking the competency or the performance of cleaning. Let's build on patient demand for better hygiene and environmental cleaning. And let's also not forget the occupational risks to cleaners as well, which are non-trivial, given the front line at which they work, particularly perhaps during the COVID-19 pandemic. And on that note, a whistle-stop tour, or we've come a long way, and we've got some areas to focus on. And I hope that there will be a productive conversation now, led with Lauren Alcon and John Brogan, who are going to facilitate. And on that note, I pass back to Hayley.
Thank you so much, Wendy. We really appreciate your remarks. All right, so now I have everyone in the group divided into 2 different breakout groups. And I'm going to open the group shortly. Let's give everybody a few minutes to settle in the groups, and hopefully everyone will go there to their correct locations. All right, I'm dividing them now.
Good morning. Oh, Nancy, it's early for you.
It's very early.
Yeah. And it's 8:30 in the evening in Singapore here.
Okay, good evening.
Well done,
to you,
Jack.
So I'm going to leave in a few minutes because of another call, but I really want to do this. I'm the founder of the World Toilet Organization. So my name is Jack Sip, and we created a movement throughout turning this subject of sanitation to center stage, because prior to that they call it water. Right? So we created the United Nations World Toilet Day, 19th of November, and so every year this is very legit, and all the governments sign up. 193 countries signed the resolution at the UN General Assembly. So I really like to take this program that is going on with Wendy to Singapore and the ASEAN countries. Yeah. So next.
Okay, great. Thanks so much, Jack. And you started us off right, because what we're going to do is just a round of the room, and really short though. Your name, your organization, and your role. That way, when we head into our discussion, we are a little familiar of who's speaking about what. So I'm going to pass the mic, and when you're done, just say you're passing the mic and pick someone else on the screen. So I'm passing the mic to Nancy, who's to my left.
Hi, I'm Nancy Gilbert. I'm the Executive Director of Transform International, which is an American NGO, but I'm Canadian and live in Canada. And it's just after 5 a.m. here, so things will brighten up over the next hour or so. I am mostly interested in this because of a program we're doing with the Desert Research Institute on addressing sustainability of wash and healthcare facilities. And we're working in Rumphi district in northern Malawi. And as part of the Circuit Rider program, we're training trainers so they in turn can train cleaners in facilities, and have struggled to find, I mean, we have the training package, but struggled to find trainers, to find means of adopting more objective ways of assessing cleaning, the efficacy of cleaning. And so, you know, I think there are obviously real gaps and issues. Anyway, sorry, I'm going on more than a few minutes. Who should, Christine?
Thank you, Nancy. Good morning, good afternoon, good evening, everyone. My name is Christine Ajulu. I work with an organization called Health Rights Advocacy Forum, in short, HERAF, based in Kenya, based in Nairobi. We work on a project around advocacy on WASH at the rural health facilities, where we're looking at 3 critical issues. One is the policy implementation. That is the development and implementation of policies around WASH in healthcare facilities. We are looking at investments in WASH. How do we prioritize WASH? How do we make it a priority to the policymakers so that they're able to set aside budgets on the same? And we're just looking at how do we rally community for this ownership, because this is something that has not been evident in our country. So my interest, or our interest in this call today, is the fact that we are talking about cleaners. And when you look at the situation in Kenya, cleaners are never regarded as part of the healthcare system, yet the role they play is very, very critical. So under this project, we have tried to bring them on board. We have done sensitization, and we're looking at how do we incorporate them into the policy space so that they are also able to influence the discussions that are going on, and how are we going to prioritize this cadre. Thank you very much. I hand over to Kyla. Oh, sorry, not Kyla. I'll drop it to Molly Patrick. Thank you.
Actually, we will go to Kyla because Molly is going to give us a little jumpstart discussion. So sorry, Molly.
Okay.
No problem. Go ahead, Kyla.
Thanks, Lauren. Thanks, Christine. Hi, everybody. Really nice and exciting to be here and be part of these sort of learning from each other discussions. My name's Kyla Smith. I work with WaterAid based in London in the UK as part of the International Programs Department's technical unit as their health focal person. And as Wendy mentioned in her presentation, we work really closely together on a few different projects. One that she mentioned was in Myanmar, and another new one starting up in Cambodia, but also some IPC and WASH work that's starting up in Malawi as well. So yeah, great to be here, and I will pass it over to John.
Hey, good morning, good afternoon, good evening. Thank you, Kyla. John Oldfield here with Global Water 2020 in Washington, D.C. Haley, thank you for putting this together. I'm interested in this session for 2 reasons. First of all, cleaners are important, period. And they're under-recognized and underweighted and undercapitalized and undertrained and underappreciated, all of this stuff. But secondly, if we properly prioritize and recognize cleaners in things like healthcare facility budgets, to me, that's a proxy indicator for a sustainably managed, a sustainably operated healthcare facility, that's budgeting the important things. So if we succeed with this, it's not simply going to be a matter of, great, cleaners are getting paid what they deserve, they're getting the protective equipment they need, and so on. If we succeed in this, this will, I believe, contribute significantly to the much broader health system strengthening efforts that many of us have underway as well. So big fan, very much looking forward to this next hour. Thank you. And let's see, I think on to Patrick next.
Hello, good morning, good afternoon, everyone. My name is Patrick Zomo. I work in Kenya with an organization called HERAF. And I work in the rural areas where I do sensitization community on WASH so that the community can advocate for more WASH resources from our government. Thank you.
Great, thank you. Wendy, I don't think we'll do an introduction. You just did one. Haley has introduced herself already. I'll take 2 seconds just to say that I'm Lauren Alcorn. I'm with the One Drop Foundation. I'm a director of programs, and I've been overseeing our Washington Healthcare Facility work. When Global Water did a call out over October, a year ago, just to ask about the work of cleaners, we quickly jumped on board because we really saw the importance and relevance of focusing on this work. We do a lot of technical assistance through looking at behavior change. So we look at this a lot through the behavior lens, and integrating the approach of social arts. So we have a lot of fun and engaging activities. When I look at the Teach Clean package, there's a lot of content there that we are interested on building on. So we'll see. So over now to Molly, who was asked to be our jumpstart speaker. We're dealing with 2 core questions in this group today. One is about the 12 actions listed in the guidance note called Elevating the Role of Your Cleaners. Haley has put it in the chat. If you haven't looked at it, please do. It's a really great guidance note. We're currently using it at One Drop. We've even created like a checklist with it. So that's the one. And then the next one, we're going to talk about what next, because we're really trying to make this a movement, right? And get things going forward. Let's not just leave the discussion here. So over to you, Molly.
Sure. Hi, thanks. And I apologize for not having my screen on. My laptop is on its last leg. So nice to meet some of you. I know some of you. My name is Molly Patrick. I work with the US CDC with the International Infection Control Program. My background is environmental engineering and WASH. And I believe you can see my slides. I put together a few slides just to kick off. Yeah, cool. So I don't actually have the questions in front of me, but I think that I have a couple minutes, and so I'm really excited to share a little bit about what we have been working on at CDC on this topic, and then some of the activities that we have upcoming. So let me go ahead and do. Okay, so some of you may know, and I actually think, and thanks to Haley and thanks to Global Water 2020, of course, for inviting me to this, and also for highlighting our best practices document that we published at the end of 2019. I believe this is actually highlighted on the wonderful guidance note that was put together. So thanks so much for that. So for some of you who may not know, I did just want to highlight this document that we published collaboratively with Infection Control Africa Network. at the end of 2019. So it is available on the guidance note, and there's a link here. I'm happy to share these slides if that could be helpful. But this just gives an overview. I'm not really going to, I didn't really want to talk about this because we're actually really happily working on some implementation guidance now that I just wanted to share briefly. But just for those of you who don't know, I mean, we published this document. So it is, you know, it was with ICANN, but it was also with WHO and a number of other partners. And we really did this because we saw, you know, there was a huge gap in guidance on environmental cleaning, and we wanted to try to help fill that gap with a focus on resource limited settings. And we also wanted to do this, you know, as Wendy said, to really try to help as well to shine a spotlight on this topic and the importance of this topic for infection control, and by extension, the importance of environmental cleaning staff in infection control and healthcare facilities. So you can see there, we actually have a cleaning staff in South Africa highlighted on the front cover. She's been a cleaning staff there for over 20 years. And so yeah, hopefully this document is sort of working alongside other documents to draw attention to this space. So as far as, you know, sort of framing things in terms of the guidance note and the 12 actions, we have 3 content chapters. Chapter 2 is really sort of the overarching chapter. So it sort of talks about, you know, key program elements for environmental cleaning, and many of the, I'll just skip to this picture. So this, you know, each box is one of these 5 program elements that we describe in the guidance document. And many of the 12 actions in the guidance note that Global Water 2020 published are highlighted here. So we're really happy to see that alignment. We do recognize that so the best practices we hope is fairly comprehensive and will help you know, facilities and other organizations to try to understand cleaning better, and you know, what are the best practices in this space. But we do recognize that there is often a large gap between guidance and implementation. So since publishing the best practices in 2019, we have been working on developing an implementation toolkit to serve as a sister document to help facilities actually implement the best practices and to provide a standardized process for doing that. So the major objectives of the toolkit are here. So it's really to sort of help a facility assess their cleaning activities against the defined best practices, including best practices and guidance that, you know, are available in their own setting. And then from there, prioritizing actions and activities to make improvements, and then systematically implementing program improvements over time. So it follows, I think, what a process that many of us are familiar with, an implementation manual. So it follows this sort of continuous quality improvement model, the PDSA approach. So you can see we've sort of structured this toolkit, you know, with 5 main steps. And we've also sort of baked into it 2 main milestones. So we wanted to define a basic program, which is really like the minimum requirements that we think should be in place, really foundational elements that, you know, are essentially prerequisites to really meeting the best practices. So, you know, we did this to, again, help sort of make the toolkit more digestible, make it achievable in a variety of settings and different facility types as well. So, you know, the basic program would be, I think, would represent, you know, strong environmental cleaning activities, you know, for a primary healthcare level, for example, whereas the advanced program and all the best practices would be a little bit further. So just a screenshot, you know, this isn't, so we have the toolkit drafted, it hasn't been sort of edited and formatted, but we've tried to keep it really simple. There's a number of tools for the sort of facility-based team to use. And then, so you can see there, we have tools templates, we have a summary of steps and estimated time. So we've tried to make it fairly user-friendly. I also would be remiss not to highlight how much WashFit was an inspiration for this. I know many of us know that document, but it's really, really strongly formatted. So, so certainly inspiration. And then this is probably not possible at all for anyone to take in. But again, I think this is the last slide I have, but We have developed, tools to help with the toolkit process. That is, the team and going through this quality improvement exercise. But then we also have a whole suite of tools that we have developed to actually help with implementation. So this is a screenshot of those. So it's actually a really long table that's divided in half, but the second columns in both of those tables are tools that we have made that will be available as sort of, in a bundle with this toolkit when we publish it. So we really hope that, and again, sort of thinking about the areas highlighted in the guidance note, we have developed a lot of content that hopefully will be of use to facilities as they make improvements. So, for example, on the left, we have, sort of a sample or template budget. We have stable cleaning policy actually fully fleshed out that then could be tailored. We have a lot of SOPs developed there in sort of the lower left, and we have included some for COVID. So again, just sort of sample template SOPs that can be adapted to the setting. We have calculators to help with supplies, even staffing calculators, because I think that our experience has been that a lot of facilities are completely understaffed, but have no idea how many cleaning staff they would even need. And then we have included as well some things more on infrastructure and supplies, and then monitoring actually is primarily from other CDC guidance that has already been published on this space. So I think I lied because I have one more slide, because of course, what are we doing now with this toolkit? So it's fully drafted and we are piloting it now. So we have 2 pilots ongoing. They both started around February, and they'll be running through the fall of this year. So we are piloting the toolkit at the Lagos University Teaching Hospital in Nigeria, and that's with ICANN and with Shade Ogunzola, who I'm sure some of you know. It's at her facility. And then we have 2 hospitals in Vietnam who are piloting the toolkit, and more from the perspective of a higher resource facility. So the pilots will end later this year. We'll make edits, improvements, and then we will be making it more widely available at the end of this year for additional use in piloting. So please reach out to me if you have interest in learning more about the toolkit, or if you have an interest in piloting it. And yeah, I'll stop there. So thanks again for giving me the opportunity to share a little bit on this.
Great, thanks so much, Molly. It's really helpful to see, and we're really excited for your tangible tool to come out. So we're opening it up now for anybody who wants to share. The first question we wanted to address was in the guidance note about elevating your cleaners, there are 12 action points or guidance points. The guidance note, if you're not sure what we're referring to, is in the chat. Haley provided a link. And it's basically, they're actions that either partners, government, civil society, advocates, donors could all address and look to. So these points are around training, supplies and facilities, hand washing, job descriptions, budgeting, policies and protocols, auditing, monitoring, indicators and mechanism, hygiene, safety, culture, performance-based incentives, committee involvement, and that pretty much, I think you haven't left anything out. So we just want to open it up to see basically which of these, if any, have you been addressing in your work, and what do you see as the next possible steps? I'm going to pick on somebody to get it going. Nancy?
Sure, I'm happy to jump in. I'm really excited about what Molly showed us, because that's what I've been struggling to find, a lot of that information. And I think the ideas are really good ones. The 12 steps is really good, but then what? Like, okay, how do you do a budget? What's a good sample job description look like? How do you actually take these things into practical use? And I think what Molly's showed us is very much that. So I will follow up with you for sure. It's so critical that we have, I think, some consistency in how we take those final steps or really put this stuff in action in the field. So
Great, thank you. So that big question of the how or what next, the recommendations are there. So yeah, great. Anybody else want to speak? Christine, Patrick, Kyla?
I'm curious what would be involved with certification. A couple of people have mentioned that, and it seems like a logical thing to look at. What's the thinking around that? How could that become more robust?
Lauren, could I jump in there? I think I mentioned on my last slide this idea about accreditation. Perhaps the sort of formal end. We've certainly found that as part of the End of a Teach Clean training package, typically participants are given a certificate of some sort. That's the trainers, so that's the master trainers who get the certificate. But I think there's no one thing to elevate and assure cleaners. I mean, it's a bit like many professionalization of just about any specialty has to have a series of things. But I do think because there are standards, then I think the fact that there are standards and sort of universally accepted standards, I think that does lend itself to accreditation, because people, if there's no standards, then what are you accredited against?
Right.
But other standards, and they're broadly accepted. Of course, there's some national adaptation. It seems to me to have, you could have accreditation at two levels. One is a facility, and that would perhaps need to tie in with more generally the core components of IPC. So whether you have it as a part, and I would advocate for that. I don't think you should have a clean facility, as it were, accredited clean facility that isn't somehow linked up with other important issues of WASH, infection prevention and control and quality. So I think, but it should be part of it. So you could do it at a facility level. I mean, there's lots of things equivalent in the maternal area of baby-friendly hospitals, for example, or breastfeeding-friendly hospitals. I mean, there's lots of examples of where hospitals, that typically it's the private sector that picks up on those sorts of status issues. So I think you just need to think about that and whether that's really going to matter to state government hospitals as well. But then I think for individuals, I mean, I think for somebody like, I think Molly mentioned that the woman cleaning from South Africa who's been doing it for 20 years, has probably not got anything that in some way officially acknowledges what she's done, that she's reached a level of practice, that she updates herself. And I think that's the other thing. I mean, we've ended up spending a lot of time working with the Red Cross about updating some preparation of cleaning fluids around COVID-19. So there is an updating, just as there is for other areas of continuous professional development, there is an updating. So to me, accreditation would deal with the status issue, it would deal with the updating issue as well, and it would be an acknowledgement. It would elevate the profession, as it were, in the same way as what happened when we professionalized midwifery back in 1910.
And presumably people who were certified would be paid more. Which,
well, they could certainly. I mean, that would improve their rights. I mean, as long as I can't. This will never be. I think the idea of creating a very appropriate accreditation scheme could be something we could develop together internationally. At the end of the day, it's going to have to be nationally owned. Right. So that's why I think it'll be better integrated with other accreditation that's going on, whether it's around quality improvement or infection prevention and control. But I do think there's a role at this international level for thinking about what are the options for accreditation? How might it work in the same way as Molly was describing with basic and advanced implementation of their toolkit? You know, in the same way, accreditation could be very basic, the sort of thing we've been doing, which is a certificate that people can use if they're changing jobs. Something which is much more, you know, people have a logbook which they maintain. So here, for example, in Scotland, where I am based at the moment, cleaners have a logbook, and a bit like competency to practice, they have to have done certain things and be checked against certain things at certain periods of time. And okay, for sometimes it does become just a tick box, but a lot of the time that logbook is a way to update cleaners on changed guidelines, but also it's something they feel very proud about. So I think for me, accreditation could be, if we can work it out so it doesn't just become a rubber stamp and it doesn't create horrible bureaucratic and become an obstacle. I think accreditation could do several things. It could raise standards. It would certainly carry on raising a profile. It would provide a scheme for making sure cleaners are updated, and it will provide a formal acknowledgement.
Great, thanks so much,
It could be
Wendy.
something the community, yes, it could be something the community practice could decide to work on together, for example.
Mhm. Okay, you will make note of that for the next question.
Yeah,
Yeah, go ahead.
sorry, Lauren. Yeah, I was just going to add a little bit to the discussion on accreditation. And yeah, I mean, it's reminding me. Sorry, my there's a 7-month-old adjacent to me. Sorry, you might hear some baby noises. Yeah, the same discussions ongoing as far as, you know, career track and professional development and certification in IPC internationally, and you know, to some extent, you know, still in the US is really being recognized as a field, and having that career track. You know, I think there's a lot of parallels there, and I don't know. I mean, I'm just sort of thinking about how does this become something separate to that, or does that become something under that broader umbrella? Because I think that, you know, one of the things that may, you know, is limiting or has been limiting for cleaners and cleaning staff in the past is not being recognized as being infection control staff. So I think that looking for opportunities to sort of bring them under the IPC fold as far as, you know, recognition, professional development, I think that might strengthen the efforts to do that. So I just mentioned that. And then the only other thing that came to my mind is that in the US there is I think it's the American Hospital Association who has Association for the Healthcare Environment, but they actually have developed this, you know, certification program for cleaning staff called CHEST. I don't know if maybe some of those based in North America might be familiar with it, but I think I could see something maybe developed like that, and I think that using Wendy's work and some of the, you know, the frontline training package now that WHO has taken on, you know, like what's the next step from there? It really could be a certification. You know, there could be different levels that could be developed. You know, again, maybe the training package for frontline as it exists now really could be basic, as we said, Wendy, and then, you know, we could think about more sort of advanced levels, because, you know, I think for cleaning staff, I mean, experience is one thing, but also you need to think about, you know, being certified to clean different areas with different levels of risk. You know, if you're cleaning an OR environment, that's considerably more training than in, you know, general wards. So, you know, that has to be recognized, I think from that professional standpoint, whether that's salary or, you know, other recognition. So anyway, just some thoughts to add to that discussion. Over.
Great, thank you, Molly. On the point, the 12 actions, we're just gonna circle back and give the opportunity to anybody else to speak to this before we shift to the next question. So Christine, I see you took your microphone off, or Kyla, either one of you, go ahead.
Okay, thank you. So on the 12 points, what HERAF has been doing is one, the bit of training, though we don't call it training per se, because it's not in depth, but we do more of sensitization on the role of cleaners and how they add value into this whole system. So they get to understand that they hold a critical role in ensuring cleanliness and everything with regards to the facility. And the reason as to why we picked this up is because we realized that in certain facilities, women were not delivering there. They would go for their antenatal clinics, but when it comes to delivery time, they would opt for another facility. And when we found out why, the reason was the facility is dirty, or they don't have adequate water. So this is where we started the advocacy around the cleaners. So the other thing we do is on the hand washing bit, where we are advocating for putting up structures where both the workers and the clients are able to find convenient points where they're able to wash their hands. And what we are looking at in this as well is the bit of disability friendly, so that they are easily accessible and they can be used by everyone. Instead of just having a hand washing sink, which is not used. So we have been able to sensitize them to modify. Is it a bucket? Are we able to fix a tap? Do we have running water? How often is this water replenished? So, and such like things. So again, we have been advocating for policy and budget work, where policies are developed to work with the various departments of health and the county level to develop the policies. And we've also supported the dissemination of policies from the national level. With the devolution in our country, there is a little bit of confusion. The policy development is at the national level, the policy implementation is at the county level. So at times you realize there is a mismatch between the development and implementation and dissemination. So we've been able to do dissemination at the county level, at the facility level, so they're able to know and understand the kind of policies that influence the work they do and how they can influence these policies. Is it a review? How do we bring their voices onto this discussion? Is it the development of a new policy? What is their role in this space? And on the budget work, again, we've also been able to influence, or it's a discussion we are having, both with the policymakers and at the community level, so that everybody comes on board and we are able to have discussions around the budget and why we need to prioritize WASH in the healthcare facility. And another positive thing is COVID came in and there was a shift, and everybody is starting to appreciate why we need water at the healthcare facility, why we need soap, why we need cleaners at the healthcare facility. Going forward, one thing that we're looking at, it's something that we haven't done that much. How do we bring the cleaners into the budget discussions? So not just looking at their remuneration, which has always been a problem, but again, how do they influence the budget process so that we are able to have whatever it is that we require, the supplies are adequate, there is training, there is support supervision, and there is mentorship at the facility level. So going forward, that is what we are looking at. And if you allow me, I'd like to add my voice onto the discussion that was brought about by Wendy earlier on the issue of accreditation. We've realized that there is a gap. People will go for training, people will further their studies, but it does not reflect on their pay, it does not reflect on their status. So it remains the same. So I'd like to support that concept of ensuring that we look at this from a front-end approach. How do we do this accreditation? And how does it roll down? How does it scale down to that cleaner at the rural health facility? How does it support them to be motivated? How does it support them to be appreciated? And how does it build onto their skills? Because as I had said earlier, they are hardly recognized. So such like things will ensure that they are motivated and they are able to do their work. Over. Thank you.
Great. Wow. Thank you so much, Christine. There's a lot of great work that you're doing there. I'm going to shift gears now to our next question, which is really, we said we had to leave time for this question because it's really super important. It's a subset of questions, but it's really about what next. Where are we going with all of this? Because we are trying to build this community of practice. So subset questions for you to think about. And I think, Haley, you put these questions in the chat, yeah? Okay, so one, how are you or your organization pushing this issue forward? The next is, who do you see as a champion in the space? Who else is missing from this table or this discussion right now? And how can this issue best align with the existing initiatives? So I'm going to open this to Kyla. I saw you take your microphone off mute and give you the opportunity to kind of meld what you were going to say earlier.
Sure. Yeah, thanks. No, thanks. I mean, this is a really critical area for water aid. And I think how I see it at the moment, I think in some areas we're sort of taking a deeper dive to really understand the environmental cleaning space, such as some of the research we're doing with Wendy and LSHTM that's starting up in Cambodia. The Teach Clean work that we did in Myanmar, where I think it was just a really good lesson for us on sort of implementing it in, quite a difficult circumstance, and also just really integrating within the government processes there. But one thing I think that we want to take forward and continue to learn is, and maybe this is something about who might be missing at the table as well, is how do we ensure there's that gender and social inclusion aspects, and sort of really including they had a really interesting review of the Teach Clean and how they could integrate some of those aspects, because that gender and social inclusion inclusion aspect was a big part of the Brighter project in Myanmar. So I think that's something that we're thinking about as we move forward. I just can quickly say thank you to Molly for the presentation, because I think that documented some of the work that we've done with ICANN on our WASH and IPC training has come in really handy. I think just maybe one other point I might mention is the one thing we're trying to pilot in the coming year is a healthcare facilities life cycle costing data collection tool, and that includes an element around environmental cleaning. What we're trying to link up with WashFit and with some of the engagement we have with healthcare facility management, involving the cleaners themselves in making sure they're integrated into the IPC committees to have those discussions around the sort of full cycle of costing that's needed to make some of the practices sustainable. And that is both at the facility level, but then sometimes the budget decisions are made at district level. So also trying to understand some of those implications and those discussions that are happening depending on the sort of financial flows within a country. So I don't know if that exactly covers this question, but yeah, those are some of the points.
Super helpful. Kyla, where are you looking to pilot this life cycle tool?
We're in discussions. There's a couple new projects starting up. So one would be in Ethiopia, another Zambia, and a potential for Malawi. So there's none of those are 100% confirmed, but we're sort of going through the tool itself and obviously trying to adapt it to those different contexts at the moment. Yeah, so we'll see where those discussions lead, and then try and document that as well. And then the other thing is just that we're in the middle of, unfortunately, a lot has changed, as you know, in Myanmar. So we're also trying to document in the coming couple months some of the learning from that project, including the Teach Clean work that's happened there as well.
Great, thank you so much. Patrick, do you want to take the opportunity to speak about what your organization is doing? Who else do you feel needs to be at this table, at the discussion, and what should we be doing next?
Okay, thank you. Although much has been said by my colleague Christine, but I can just add a little bit. We are trying to have community and policymakers get into the budget making process, because in Kenya we have a cycle of budget making. So we are encouraging them to participate through public participation, to make memos on or petition on WASH funding, so that we can have adequate cleaners in our facilities. We can have adequate WASH supplies in our facilities, and our cleaners are paid, and most of them are on permanent basis. Thank you.
Great, thank you so much, Patrick.
Could I please add something?
Yes, please.
just on what Patrick has mentioned, we work together. So the other bit we are looking at is the policy makers. We have in Kenya, we have a group called members of the county assembly, who are charged with the responsibility of approving budgets and monitoring the implementations of budgets. So this is a critical arm that we are also bringing onto this discussion, so that when a budget is presented, they get to understand why we are asking for certain amounts or certain figures. Because what happens, the policy gives them the leeway to reduce or cut budgets without any explanation. So behind the scene, or before the budgets get to the House or the assemblies, then we are able to engage them. We are able to organize platforms and just to bring them to speed why we are asking for certain monies and why they need to approve them. So that will also go a long way in ensuring that we have resources for WASH, and there is constant pay, because the cleaners suffer when it comes to budget cuts. So that is another thing we're looking at. Thank you.
Great, thank you so much. Yes, Wendy, please go ahead.
I guess the sort of elephant in the room a little bit is that cleaners are not a universal. It's a bit, reminds me very much of the conversation about traditional birth attendants. I mean, they're not the same the world over, and the same is true for cleaners. We're using that word as a sort of as a catch-all. But I think in that we have to recognize that there's cleaning and cleaners. And certainly COVID-19 has changed some of the landscape around cleaning, and certainly some of the procedures. If I think about the award that I'm on, some of those procedures have changed, and some of the cleaning has become much more a nursing duty again. It then moved away into cleaners, and now it's come back to being a nursing duty. And I think in the WHO package, they use this phrase, those who clean. And to a certain extent that sort of partly helps, but I think we do need to acknowledge that diversity and not to create a tension here, because nurses, and if you move to OR, move to the operating theatre, it typically is the theatre technician, or it may indeed be a theatre nurse who does the cleaning. So we've got to also, there are the cleaners, for example, the groups that we've worked with, which are typically, hence developing Teach Clean, low literacy, typically marginalised in society, often women, but not exclusively women, very few rights, etc. So that's the group that we've noticed. But as we get more involved in different diverse settings, you have to acknowledge that cleaners are not one and the same. And thinking about that question, who is the champion in the space? I mean, I think that we need to make sure the nursing and midwifery profession is closely aligned in this. I mean, I think that the relationship with the clinicians, the medical doctors, but if the medical doctor, the chief medical officer of a facility needs to be involved and feel passionate about the importance of training cleaners. But when it comes down to this front line, it's basically nurses or midwives and the cleaners. Sometimes there's auxiliaries as well. I think we need to make sure, in the same way as we're clear now that this space needs to link across to infection prevention and control, and also to WASH. There's a bigger area of quality improvement, which is a sort of umbrella heading, or patient safety, for example. But I think we also, in terms of cadres, we need to recognize that the core providers are nurses and midwives, and make sure that, because they often are the supervisors of cleaners. And in the past, I mean, I had this campaign, Bring Back Matron. I'm so old, but I do remember the days of matron, who you feared if you didn't clean properly, if people didn't clean properly. But that's not the right tone to fear. But there was one person who really took it as their responsibility, and they walked the walk and they talked the talk, and they went round and they pointed out when the bin wasn't empty, and they pointed out about the shortage of cleaning fluids, and they talked to the cleaners and pointed out the good job they're doing. Now, I know health systems become much more complex and so have facilities, but I think we need to make sure this activity, because cleaning is a core activity also for nurses and midwives. And I don't think we've had enough engagement with, by them or with them. I'm not pointing fingers, but that's a really big opportunity that we need to address as well. So I think champions in this space could be nurses and midwives, and I just don't see them engaged at the moment in the cleaning conversation.
Great, thank you so much. That's a really key point. We still have 6 minutes, I believe. So anybody else want to speak to the what next? Any suggestions, recommendations?
Hey,
May
Lauren.
oh, go ahead.
No, please, after you, Nancy.
Oh, I was just going to say, can I ask a question about monitoring? I'm going to take advantage of having all these experts available to me. You mentioned gel dots, Wendy. Are there, I mean, you know, what I've read about objective ways of monitoring how effectively a space has been cleaned, it's not very clear. There, you know, there are a couple of different options, there are pros and cons, but Malawi, a rural clinic, what would be a sensible approach?
Well, I still feel visual inspection is still needed, because sometimes it's so obvious that it's not right.
Yeah, for sure.
Surface microbiology. So I think the first thing, we will always need visual inspection. And you can use it very constructively as well. I mean, we've used a lot of photo voice, where we'll take a picture of something and then we'll discuss it with, not in a destructive way, but sometimes people get so close to these environments, they don't actually notice what to somebody coming outside is pointing out as obvious. So I think number one is always visual inspection, done constructively. I think things like we go right the way down to surface microbiology, so we can actually do things which are called hygiene failures. It's a way, it's what's called an aerobic colony count. I mean, basically we use very simple slides that are pressed against a surface and it's incubated, and it tells you how contaminated that surface is. And there's a certain point in contamination when you say it's a hygiene failure. Now, a hygiene failure is a very loaded terminology, but it often is something that really grabs attention and you can objectively assess it. The gel dots are much more, and they were used, I can send you some examples, they're very simple to use. They're basically a little bit of sort of sticky that you put on a surface, and it requires a degree of intensity of cleaning to remove it. And it's got a UV aspect to it. So you just shine a simple torch and you see, has it gone, has it not gone? It's rocket science. We did use it, we've used it in a number of different settings, but now we think it really belongs as something much more routine for assessing performance and congratulating cleaners, as well as pointing out areas that don't. So I can follow up with you, Nancy.
That would be wonderful.
I will on this occasion.
No, thank you.
And Nancy, I just put in the chat a web link to some resources from that CDC has published. So it's fairly, there's a lot of content on that page, but essentially if you scroll down, I think on the fluorescent gel, that there's some notes about, you know, where would be good spots to actually, you know, mark as far as high touch surfaces. And then there's some templates there at the bottom too. There's 3, I think there's like a PDF and maybe an Excel too. So just practically as far as tools, that might help your team.
Awesome, thanks, Molly.
Great, 5 minutes left. John, you wanted to say something?
Yeah, Lauren, thank you. Just a couple of quick reactions on this next steps business. It strikes me that typically we need, you know, the Washington healthcare facilities crowd or the cleaners crowd here need fewer WASH advocates and more health advocates as the key messengers. And this is actually a nice mix we have here today. You know, we've got more health people than WASH people for a change. And you know, I'm a WASH guy, no disrespect to myself and my organization, but so I don't know how to do that. Haley and we're constantly badgering the Global Water 2020 team to bring in more health advocates. And it's great to see Christine and Patrick from HERA here, for example. But next steps wise, you know, I'm thinking about how do we get more health leaders on board? You know, I think it was Molly that said something earlier about, you know, is it a good idea to integrate this cleaners business into more traditional IPC umbrella? Or is it a good idea to integrate this cleaners business into AMR? fewer antibiotics, more cleaning, fewer antibiotics, and so on. Wendy, I love this distinction that, if I understand, you've drawn between cleaners and those who clean. Those who clean is every single day I'm one of us. I'm also struck by, and maybe the other work breakout session is different. There's only 2 men on this one. Thank you, Patrick, for hanging in there. Maybe that's a problem too. Real men clean up after themselves. Real men clean. Or maybe there's something there. I'm looking. My point is, I'm trying to find ways. Christine mentioned their advocacy work targeting health leaders, health ministers at different levels in Kenya. What's it going to take? Who are the right messengers? Who do those health leaders trust when they say, listen, you guys need a budget for cleaners in your healthcare facility? I think there's a missing link there. The asks aren't being made at the right time by the right messengers, and the WASH community is not the messengers. Wendy, I think you're onto something. I think nurses and midwives could well be the messenger, or I would broaden that to healthcare professionals, including doctors. We cannot do our jobs without WASH. We do not want to pump mothers full of antibiotics when they're about to give birth, because we can't guarantee hygiene facility in our facilities. So I think we need to think about the messengers, the advocates, and I think they need to come primarily from the health space here. And that's obviously a core part of our day job at Global Water 2020. Over.
Just a very practical thing around that. I mean, I suppose I sit here thinking about World Health Assembly, and it obviously takes an act of parliament, as they say in the United Kingdom, to get something like that in place. But is there some way? I mean, it's next week, and the opportunity that happened in 2019 with the Golden Mop. I mean, there are these questions of opportunities. Is there not somebody attending this afternoon who is going to be at World Health Assembly? I'm sure WaterAid is. Is there something we can do to get the wording back in there? I mean, we could do it either through there's a lot of conversation about international nurses, the year of the International Year of the Midwife and the nurse. So there's that sort of angle. But I think you're right, John. I mean, the question is where to locate this. I think we can have our cake and eat it. So I don't think we should locate it singularly in a particular silo. I think we should run the whole gambit of opportunities and recognize that this, cleaning is a universal issue. I wouldn't nail our mask to one or the other, but I think, going with professionals, going with WASH, going with IPC, going with AMR, it's relevant throughout, and it's that universality that we need to get some messages to. It's universal to the public as well, and particularly at the moment with COVID-19, cleaning in hide hand, but also cleaning your environment, surfaces, contaminated surfaces. So I have a big question. It's next week. Can we do anything to get a smart message somehow placed in the discussions next week?
Thank you, Wendy. Haley, hopefully you can carry that question into our closing, because we're going to be leaving this room in 2 seconds, and maybe someone's attending the World Health Assembly and could help carry that torch forward. And yeah, we certainly have a lot of people here around the table who are pushing for this. So there's a force, and we will see. If anybody has a 20-second bit they want to speak to.
Jack Sim has sent me about 5 WhatsApp messages. Let's put him to work in Asia. He loves this stuff, seriously.
Yeah,
check out Uncle Desmond.
He's got good energy. Yeah, that sounds great. All right, we'll see you all in the big room.
Down to the key end users. And one of the key end users we've identified are environmental and cleaning staff, because of course they play an absolutely crucial role in not only the reduction of antimicrobial resistance, but in the reduction of healthcare infections in general. And so the program that we're working on is to operationalize the Teach Clean project into the maternity units in different facilities and at the country level, working within the WHO regional office construct. I'm happy to be involved, and back over to you.
Thank you very much. Thank you, Stephen. Julie?
Hi, so I'm Julie Store. I am a nurse by background and I've worked independently for many different WHO programs, and I'm currently working specifically with the WASH team at WHO headquarters and also the infection prevention and control team, and also a little bit of my time with the quality team. And I've previously supported some of the work that Stephen has just mentioned as well. And yeah, I just recently published an article on the role of cleaners in low and middle income countries and the general ethos of what Professor Graham said. So I'm delighted to be here as well. Thank you.
Thank you, Jules. Prakash.
Thank you, John. Good morning and good afternoon, everyone. This is Prakash, and I'm from Terrorism Foundation, and I'm responsible for the management of WASH and Health program for Terrorism in Nepal. So currently, I'm in charge of a project that focuses on WASH in institution and community, which is funded by SDC and managed by Swiss Water and Sanitation Consortium Phase 3. Yeah, definitely we'll discuss more during our discussion. Thank you.
Thanks, Prakash. Kelly?
Hi, everyone. My name is Kelly Bridges, and I'm a senior associate with Global Water 2020. And I will also be the rapporteur for this breakout room, and we'll share momentarily some of the discussion questions that we'll dig into after the introductions.
Thanks, Kelly. I'm just looking. Hester.
Thank you so much. So my name is Hester Nyasulu. I am working with the White Ribbon Alliance, Malawi. So White Ribbon Alliance is the organization that conducted the What Women Want campaign, which was referred to during the presentation, where globally we interviewed 1.2 million women and girls. And in Malawi here, we interviewed about 84,000 women. Now, from there, I think as you've heard, the issue of WASH came out strongly, and that's what has prompted us to have an interest to work in the area of WASH in health facilities. And the issue about cleaners come in as well. So our participation is in this meeting is to understand more on the scope and then see how best we can implement those activities here in Malawi. Thank you very much.
Thank you, Hester.
John, I think we may have lost you. So maybe while John is reconnecting, maybe Ketty, it would be great to hear from you next.
Okay. Hi, I'm Kate Harawa. I work for Water for People. Our organization's vision is to make sure that everyone have access to safe water and safe drinking water. And when we say everyone, we mean every person, every school, every household, every clinic. So the WASH in the health facility comes in when we talk about everyone, and everyone meaning even people that I know. Thank you very much.
Everyone, sorry, I don't know how I got dropped off, but I'm back, and thank you very much, Ketty, for that. Did Bubala have a chance to introduce?
Thank you. Good afternoon, good morning, everyone. My name is Bubala Mumba from the Zambia NGO WASH Forum. We are a network of WASH civil society organizations working together to improve water and sanitation and hygiene access in Zambia. We have a special interest, the topic at hand, because we're particularly interested interested in institutional WASH, in particular WASH in healthcare facilities, and we're keen to learn from the experiences of others through this call. Thank you.
Great, thank you very much, Bubala. Rebecca.
Yeah, hi everyone. My name's Rebecca. I'm a reporter for DevEx, and I cover water and sanitation, so healthcare facilities and cleanliness and nurses has been something that I've been covering for the last couple of years. So yeah, looking forward to listening to this discussion today.
Great, thanks a lot, everyone. I'm just looking around to see if there might be any that I've missed, but has anyone else yet to introduce himself or herself? Okay, great. So let's get started. Just to remind the questions that we're going to be looking at today. You know, as Wendy really started us off saying that COVID has dramatically increased the awareness about the importance of cleaning and also who is cleaning in these healthcare facilities and the risks that they have there on the front lines. And what can we do about that? And how do we really take this forward as a community of practice? These people need tools, they need disinfectants, they need training, and they also need a certain level of recognition, among other things. So really the questions we'll be looking at, the two key ones are, how has COVID-19 really changed the dynamic with this embedding better environmental cleaning practices? Have you been involved in this? How do you plan to build on this in your own work, whether you are an advisor, whether you are an expert, or whether you are an implementer in the field? And then we also want to come to another discussion in the final 20 minutes about the what's next. So how are we going to push this forward, this issue forward? How can we take this forward and really make a difference? So we do have Jennifer Pitchin, who's agreed to start us off and to share her experience on this front, as well as that of OneDrop. So just want to hand over to you, Jennifer, and thanks for starting us off today.
My pleasure. Thanks, John. So indeed, we've been working in Haiti specifically on this issue, as well as in Malawi and in West Africa, in Burkina and in Mali. And also now in India, we've worked more in the healthcare facilities. So I'll be speaking specifically to Haiti, because that's the project that I manage and oversee. So we're working in the Artibonite region in 35 healthcare facilities. And really, you know, what's happened this year with COVID is to put a lot of emphasis on cleaning beyond just the integration of cleaning within the 5 dimensions of the JMP approach to WASH, but also really looking at it from a healthcare facility safety perspective. So usually we took more of a quality of care perspective. But now it's obviously become really this urgent need. So I think it really put a lot of importance, and I think it really drew the attention of healthcare facility staff in the sense that cleaners really became their allies. And, you know, so this importance kind of became recognized, and we've really drawn on that. So generally speaking, we've taken a results-based financing approach in the general project. And that's really what I had wanted to speak to this morning. And so it really integrates these 12 essential steps that were outlined in the briefing document. And I think that's really, we've taken it kind of a step further with COVID. And so because of COVID, there was the ability to, I guess you could call it, accelerate the work. And so a lot of funding was brought in, additional funding, in order to provide these supplies and also put in emergency measures for hand washing, provision of soap, chlorine, other disinfectants, like she was saying earlier, Wendy, the mops and buckets, really ensuring that all of the supply chain was put in place. But I think it's the results-based financing that's going to help support it in the long term. So our biggest concern right now is, of course, there was the big push with COVID. In order to, you know, urgently take into account better cleaning both of surfaces and, you know, disposal of fluids. We have gestion des déchets biomédicaux biomedical waste management was really a big issue, and also treating of gray water, dirty water. So both of that was really pushed forward with COVID. So we've been really insistent on incinerators, placenta bifos, basically safe areas to dispose of placentas. And so all of this has really been pushed forward in the past year. An element that OneDrop, so a lot of it was, of course, infrastructure, but a lot of it is also putting in place both the protocols, training mechanisms, and also, like I was mentioning before, these financial incentives through business plans, indicators, and external monitoring to make sure that the work is being cyclical. So when supplies are running out, they have a business plan that takes into account the actual cost of replenishing those supplies through local market chains, and external verification to ensure that when people do present themselves and check in, that if they are meeting these targets and if they are keeping things running as they were trained to do, then they are also given personal incentives, but also institutional incentives. And those institutional incentives are then reinvested in order to maintain the supply. So we found that this has been relatively successful. Obviously, there have been some local market supply interruptions due to COVID. But overall, it's been an interesting step forward, and it's something that we'll be maintaining. So this is really something that is within the project over the next 2.5 years we still have remaining. So it goes beyond COVID. And so our hope is really that this will help institutionalize this practice, and also including the cleaners as part of that committee, of that core committee, to ensure that their voices are being heard around the table, and that it's not just healthcare administrators and higher level medical professionals, but really the cleaners have a voice in talking about the supplies that they need and what they need in order to do their jobs correctly. So yeah, I guess the last piece that I do want to bring forward is, of course, OneDrop's unique social art for behavior change approach. And so this is really working with artists and with target groups, including cleaners and healthcare staff. So we have basically right now, we've done a lot of different approaches, murals, radio shows, music videos, and right now we have 10 mixed teams of different healthcare facility staff, including cleaners, midwives, nurses, auxiliary nurses, doctors, who are writing songs around hand washing with soap. And so really looking at integrating the determinants, psychosocial, contextual, and technological within the songs, including some of the ones that have come out around pride, around the ability to do your job right, your responsibility as a healthcare provider, and also safety. So safety of both the patient and healthcare staff in this importance of hand washing and how to integrate it in your daily routine. So they're writing them now. We're judging the songs, and 3 of the top teams will be turned into, again, music videos that will be played in waiting rooms and through healthcare facilities. So yeah.
That's great. Thanks a lot for that, Jennifer. Really interesting to hear what's going on and inspiring to hear what's going on in Haiti. A very complex context working in, to say the least. And definitely a big fan of the social art work that you've done. Our projects have benefited from that in Mali with the WashFit designs. So that's great to hear. I'd like to go over to Stephen, because I know, Stephen, you might have to drop off the call early to go on another meeting. So could I just call on you to share some thoughts about how the dynamic has changed for COVID, please?
Sure, thank you. And I'd like to start by saying that I'd like to acknowledge that Julie Stowe and her colleague Claire Kilpatrick really worked very hard with me on developing the project, and to say that I'm completely jealous of the fact that I'm not going to have a music video for this particular project, because that just makes this project super not awesome at all. So it's a shame that we're not going to have a music video, but hopefully we can get to that level of where the folks in Haiti are. So the issue is that in WHO, in WHO in general, we understand the value of cleaning staff and the value of environmental hygiene. How do we understand that? We know that because our global IPC recommendations, which are referred to as the core components, and the minimum requirements for IPC programs, identify cleaners as key personnel in health service delivery. The Global Action Plan on Antimicrobial Resistance, and I sit in the Antimicrobial Resistance Division, also highlights the need for awareness, education, and hygiene training, including to improve WASH and IPC. We've had a World Health Assembly resolution in WHA 72 in 2019, which said that it described the need to invest in a sufficiently well-trained health workforce, including cleaners. And we know that the core components of IPC programs in acute and national health facilities highlight the need for a trained workforce, and it's also in the Global Action Plan for AMR. So we all agree on it, and as you would, and as maybe is expected, WHO at the moment has no current or comprehensive training guides designed to help and support the staff who are responsible for environmental hygiene in health facilities. And so we have this enormous disparity and disconnect between what we know needs to happen and how we're going to make it occur. And then, as you know, in order to make behavior change, you need three elements. You need knowledge, you need incentives, and you need an infrastructure or facility to help make these things implementable. WHO is really, really good at the knowledge bit. We've got all the knowledge that you might want. And in terms of the incentive, COVID presented a massive incentive because COVID raised the profile of cleaning, of just the physical act of keeping an environment clean, to a level that has now become more accepted globally. And so the incentive is that we understand that cleaning is no longer something that should be ignored. And I live in Geneva, and right now we have people who do not leave their house without their hand sanitizer, and there is cleaning taking place in all of the trains, and and 2 years ago, this would be unheard of, just not even a possibility. And so the final element of this is the facility or the infrastructure, and this is where we decided to partner with Professor Graham and the Soapbox Collaborative to investigate the ability of the Teach Clean training program to help train environmental and cleaning staff to maintain environmental standards, particularly in maternity units. Now, Teach Clean, as Professor Graham had described earlier, was developed with the maternity unit in mind. The WHO team decided to keep that focus for our particular approach. But what we've done, and this is where Claire and Julie were excellent, is that we included some of that WHO knowledge that I talked about from AMR, from infection prevention and control, and from WASH, as well as from quality of care, into the Teach Clean teaching curriculum to kind of fill out those particular areas. And the objective is to pilot this slightly redone Teach Clean teaching curriculum at facilities, at maternity units, in facilities in different WHO regions, where the one where we're most advanced is in the EMRO, the Eastern Mediterranean region at the moment. And so what we're trying to accomplish here is to deliver an effective, technically sound, WHO compliant, multimodal training approach that incorporates adult learning technology and incorporates adult learning theory to improve environmental hygiene in maternity units by investing in the cleaning staff as a key member of the healthcare team. Because previously, as I think we can all appreciate, the cleaning staff was seen as disposable, or as invisible, or as not worthy of development, or as not interested in training. And as long as you can stick a mop in somebody's hand and point them in a direction, that's all that they need. And we think that the opportunity has been that COVID has shown us that that is no longer adequate, and that the level of development and instruction needs to be increased to reflect the importance of the cleaning staff in the maintenance of environmental hygiene standards, particularly in a maternity unit. And so this is what we have done. And we're very pleased to have worked with Professor Graham in the London School to adapt an existing program. It makes no sense to try to create something from scratch because that wastes everybody's time. But to adapt an existing program that has already been used at a country level, but to just fill in some of those blanks with the WHO knowledge base making sure that it's consistent with our norms and standards, and then trying to implement it on a WHO, within the WHO infrastructure to see how it could work. We believe that if these standards, if the training curriculum that we are going to implement in collaboration with the Soapbox Collaborative, if it's successful in the maternity unit, we don't think that it would be rocket science or brain surgery to extend it to other units in the hospital, but we decided to focus on the maternity unit, given that that pregnant women represent an enormous population, enormously vulnerable population that directly feels the impact of poor environmental standards in their clinical status. And so we decided to focus the pilot in this direction first, and then we can see how we can move forward. And so the objective is to ensure that the rank and file cleaning staff is responsible for cleaning the facilities, as well as their command and control structure within the facility, understand the importance and the value of investing in and training, formally training their cleaning staff in order to maintain the environmental standards. And of course, ultimately, we hope to improve the health indices that are associated with the maternity unit and associated with antenatal care. And also, to be completely honest, we feel that a clean environment to deliver a baby is a very important part of dignity. It's a very important part of the human right of being able to start your child's life in a pleasant, clean, hygienic environment. We see this almost as a human rights issue, as much as a management issue, as much as a training issue, as much as a workforce issue. And we think that we want to raise the level of this conversation so that we can appreciate the cleaning staff for the absolutely crucial role that they play in reducing healthcare associated infections, reducing antimicrobial resistance, and in improving clinical indices that we will be able to see hopefully in a very short period of time. Thank you so much for being flexible enough to allow me to speak, and I look forward to hearing from the other colleagues. Over.
Stephen, thanks so much for that intervention. This is really exciting that these comprehensive training guides adapted from Teach Clean are coming out. What a wonderful effort. Really sounds like what can help us get from point A to point B, and can definitely be part of an important position in the next steps that we'll be talking about with COVID. Who else would like to share their experience, maybe going to the field, some field-based colleagues on how COVID-19 has really changed the dynamic of your programming?
Yes, John.
Thanks, Prakash. Go ahead, yeah.
Yeah, John. Sorry, my connection is not that good, so I'll turn off my video. Yeah. Yes, but John, I think we all know that the cleaner are important. The environmental cleaning is very important within the healthcare facility setting. But the COVID, I think, has contributed to make realize the local policy maker about the importance of this issue, and also the current infrastructure and resources are not sufficient for that. Not ready for that, or there is need for investment. This is something that we have I realized actually we realized basically, and authorities basically whom this issue was not a priority area, they have started talking about this issue, which is which is very interesting actually for us, because we are working closely with the local government. They in terms of resources, they do have very good resources, financial resources as well as authority. But this issue was not that much prioritized by this government. But now after COVID, they have started realizing the importance of this issue. And due to COVID, it helps us as well to do advocacy with them, and then basically to identify the areas of intervention. Like now they are asking, they are coming to us and asking us to seeking technical support, which is quite interesting actually. Now they are saying that okay, this is the issue, so what we can do, like, or whether do we have like they are coming with the resources, which is very interesting. But in the past, which wasn't a case, where we had to go with them, and we have to realize them the importance of issue, and they were very reluctant to share the resources, but which is dramatically changed after this. And I think there are several other factors as well, John. Here, I'd like to highlight, because when we talk about the environmental cleaning, I think there are a few things that are very important. This is due to COVID as well, as well as for the other due to other reason as well. One is, the how we are taking or thinking about our cleaners. So basically, I think my previous colleagues also highlighted on that part. I think here the cleaner, as we all know, like since we are all working in this sector, so they are neglected actually. They are not respected. They are neglected in the healthcare facility setting. But now in the current situation, through our some of our advocacy activities, as well, or through our programming, uh, if we the learning, I mean the experiences that we have with the learning we have gained is, if we like engage or include them in some of the health like committees at the healthcare facility level, that significantly contribute actually to the environmental cleaning practices, to improve that practices. So this is one of the like that we have realized based on our experiences while working in I think more than 50 healthcare facilities so far. So one is that I'm referring here is one of the committee could be like WashFit committees. So and that is quite interesting. Another is the training model methodology that we use basically, because IPs there in Nepal, in case of Nepal, basically we have a national curriculum for infection prevention and control and healthcare waste management. So, but it's a one-time training. But in case of TDS, this quite interestingly, we supported government because in the rural areas it's difficult to find trainer, a good skilled trainer who could provide support to the trainer. But here, what we did is we collaborated with the local government. We also shared resources. We supported them to train, develop master trainer, so that like now in the current situation we are able to mobilize them in different part of the country whenever we need them, and they are very happy to do those training, and they're most importantly they are very much skillful on how to build capacities of like cleaner, how to focus on, and how to highlight the importance of role of cleaner during the SCF visit and training. So I think these are the few things that I think has been like the things are changing definitely. The COVID has contributed to that, as well as some of the work that we have been doing on the ground has also contributed to make it happen. Yeah.
Thanks a lot, Prakash, for sharing your experience. It's really nice to see that there is something which is shifting. It felt like, if I also paraphrase what you were saying, we were always running after the authorities and those with decision-making power, and now they're coming to us, and this is a real big shift and a wave that we have to ride. So,
exactly.
So, yeah.
Exactly, John.
Floor is open for other contributions. You'd like to add in, join, share your thoughts and experience on this, please feel free to unmute your mic, leaving on or off your video, and share.
So John, I'd like to add one more. So if you allow me to do that, or I'll let other.
Sure, yeah, while we're waiting for the next speaker, sure.
Sorry, sorry, yeah, okay.
No, Prakash, go ahead, please.
Okay, I wanted to share one of the experiences that from the field, from Nepal, basically from our project site, from this project, where basically, as I said earlier, we were the one who were realizing the local authorities about the importance of WASH, like water sanitation hygiene institution, need of like I mean importance of IPC and all that thing. But we recently did one meeting with them, which is quite interesting. We discussed among our team, and we were struggling actually just before the COVID. We were struggling actually how to make them realize about this importance of this issue. Then we came to the conclusion that okay, let's collect some photographs, of the like that shows the issue within the healthcare facility. I mean, challenges of the health worker, challenges of the cleaner, and importance of cleaner. So we collected those photographs, and then we organized one meeting with the local authorities. It was just for like this photo presentation. It was nothing like text, because we were aware that they are not interested in basically in this topic. So then when we started presenting photograph with some caption, at the end, I think the mayor of one of the municipality, he was he was kind of very serious. He said that okay, I think this is a great I mean, you have done a great job that you kind of open our eyes. We're not aware about this issue. Through photo presentation, you made us realize basically, because he realizes that he consider himself as a patient, as a health facility visitor. So he realized that okay, this could be like him actually. So who can get this infection, he can also suffer from that like issues. So then he was happy, and then immediately after that, he decided to organize training for the health facility staff, as well as he decided to supply material. So even we had budgeted for that, but he said, no, you don't need to do that. We will do that. So this is quite, one of the examples that I wanted to share. Thank you.
Thanks a lot for that compliment, Prakash. Yeah, a really good sign, willing to invest in it, making that situation part of his own experience and that realization. Very important. Thanks again. The floor is open for any compliments or ideas, remarks coming off of what Prakash has shared. Stephen, Jennifer.
I think I see Julia. Do you have your hand up?
Yes, it was a separate point, so I was. So I'm happy to go whenever I get the permission, John.
Oh, it's open, really. We've had a few drop-offs.
So my point is more of a reflection and perhaps a question as well. And it kind of was stimulated by what Jennifer was saying and about the one drop work, which sounds really positive and hopeful. But then in my mind, I'm kind of balancing that with what might happen next that's maybe not as hopeful, given that historically we know in the immediate aftermath of pandemics and epidemics, there tends to be lots of activity, but that we forget very quickly. And I'm thinking back to what happened, with Ebola in 2014-15. So I think I'm trying to think of how we can address maybe some of the issues that have been raised recently. And I'm thinking particularly about the JMP WHO UNICEF report that was issued in December last year. So we have more data, and data are powerful in advocacy terms. But one of the glaring gaps in that data was around environmental cleaning. In fact, there was insufficient data that was gathered during that exercise to be useful. And I think that was a concern. And I wonder, I'd be really interested in hearing from any of you in this virtual room about, what can we do to plug that gap so that the next time JMP publish, we've not just got data on water and hygiene and sanitation, but that we've got some really powerful data that can help with the sustainability, because it's clear from what Professor Graham and others are saying as well, is there's almost a dichotomy. COVID has made us really refocus on the fundamentals and cleaning and the environment, and those who clean, we do need to value and invest and train. But I suppose maybe I'm being pessimistic, but I'm just worried that we'll forget and default back to a situation that we don't want, which was pre-pandemic, that wasn't a good one for the state of environmental hygiene across many countries of the world. So yeah, I'll stop.
Excellent question and contribution. Thank you, Julia. I see your hand, because now I can see hands if people are doing this. Thank you. Go ahead, Jennifer.
No, I think Julia hit the nail on the head, and I think that's been a huge issue. Just looking at specifically, for example, in Haiti, so much behavior change around water and sanitation was focused on cholera for many years. And so we've heard time and again that, cholera is over, so no big deal, it's fine. And so the same, there was this big peak of action and, distribution of chlorine tablets and all of this like super, urgent approach where this focus was. And then, as soon as the peak passed, then same, it just all kind of fell down and behaviors reverted to pre-epidemic at that case. And I think we will see something very similar with COVID, and it is a huge concern. And so for us anyways, in our interventions, the focus has really been, we were there before and we will continue to be there after. We did get an 18-month extension on this project, partially due to delays with COVID, but also because we know that taking a long-term perspective and a long-term approach is really key. And also what's been really interesting is avoiding the focus on COVID. So especially with all of like our songs and all of our interventions and even the trainings, like, yes, of course, COVID has specificities that have to be addressed, but it's not just about COVID. So we're not washing our hands because of COVID, we're washing our hands because we're healthcare practitioners and we must wash our hands, and kind of avoiding this language of it's because of COVID. So there was a very specific set of interventions, a COVID response plan that was, really around providing these urgent hand washing stations and, urgent supplies and PPE and all of those interventions that had to be because of COVID. But we really kind of segmented those into an emergency response plan. And then the rest is kind of business as usual to make sure that it's a long-term perspective with sort of this, like I was saying before, around like local supply chains and ongoing training and institutionalized policies, procedures, and just making sure that the approach doesn't take sort of this short-term focus, because otherwise we do know it will fall. And I liked your point also on the JMP data. And I think that's part of where we worked with the CDC to do an initial diagnostic in order to use WashFit and collect all of the data for a baseline. And then we will be doing that again at the end of project to report back on our region at least. And we do think that that's it. Between that and also the results-based financing, which has its own indicator mechanisms that feed into the national data system, hopefully we can also help to provide a bit more clarity on where we stand on this in our region at least.
Hester, please.
Hello. Yes, building up on Jennifer's input, I think a good point that she has raised of ensuring that the response that we've had on COVID in terms of hygiene is embedded as a culture into the system that is ongoing. In Malawi now, we have seen the reduction in the infection rate at the moment, and already the behaviors are starting to change. when you move out there, masks are no longer being put on, and also the mandatory issues of one to be washing hands, you know, and ensuring that they sanitize before they're entering into buildings is also dying off, just remaining in those key areas where they're trying to enforce. So if this comes in our health facilities, then we'll be going back to zero, and yet we could have rode on this issue that we have now on COVID and make sure that we maintain the culture and the systems in place. It will also go in terms of messaging. How do we now push the issue, and how do we advocate now, even with the policy makers? I think those are the key things that we need to start discussing. Now, I heard, Jennifer, you have worked in Malawi, or you work in Malawi as well. But from what I see in terms of training of the cleaners, I don't know if there's something that you've done specifically, but I see it's one of the neglected areas if we look at the way we operate in our health facilities. In some big facilities like the central hospitals, they are contracting out, so they are outsourcing the cleaning services. But in that case, how far do we go in reaching out even to those companies that are outsourced and making sure that they're doing quality job? And in the district hospitals, the health facilities, we have cleaners, but how much more are we reaching out to them? Very little that I've heard of any training really targeted and a comprehensive one across the country, unless, Jennifer, if you have any experience in this area. But I thought from what I've been hearing from the contributions around is something that we need to focus on and try to engage the cleaners, and also maybe even helping them on how they can raise the issues that they are affecting them. So if they don't have equipment, for instance, how do they engage the district health authorities for them to respond to their needs? Because there are simple things that they need, but you find those are the things that are not there. Even the PPEs for them is also quite an issue. So those are things that I really have picked from here, and they feel that we need to energize these efforts in Malawi. Over.
Thanks a lot, Hester. Jennifer, did you want to come back on that?
Sure. Thanks, Hester, for the questions. Indeed, I wasn't responsible for the project in Malawi, so I'm less familiar with it. My colleague who's in the other group can definitely speak to that, Lauren. So I would suggest we could put you in touch, and maybe she could give you a bit deeper answers. I do know we worked at district level. I remember Salima and two other districts, but I can't remember their names. And so we were working really at that district level, but we did transfer, the project closed last year, but we did transfer all of the materials, all of the training materials and social art for behavior change materials and guides with the Malawi government Ministry of Health. They were directly involved in the project. And so there's been a lot of work with them. So Lauren could really speak to you regarding how that work was institutionalized and is going to hopefully be replicated by the ministry in other areas. But I do know there was a focus on training cleaners, but at a district level. And my understanding was that they were part of healthcare facilities. They were dedicated staff, even though I do understand that I think much like in Haiti and much like is an issue around the world, they aren't necessarily full-fledged members of the team and recognized with such contracts and pay, et cetera. I know that's a huge issue.
Thanks, Jennifer. Also on this question that Julie raised, you responded on WashFit having some critical indicators in there. And we know WashFit is really starting to take off, and there's going to be a new version which is coming out, maybe even a digital version. And I think a lot of projects are trying to advocate for WashFit being part of a municipal planning tool, or being part of a tool which is getting measured at the regional and national levels. So that could also be a game changer, but I do think it's important maybe to understand where we were just before COVID, where we were right at COVID, and then what is the difference that this push or this investment has made as a result of COVID, to be able to always go back and say, hey, we achieved this with the resources that we got through COVID. So we do have a few more minutes left, and we do have these next steps, right, Kelly? We want to look at the next steps. I don't know that we've really addressed that yet. So those are on the call, this breakout room in your capacity. What do you feel should happen as we go forward? Mainly, maybe as a community of practice, maybe we can take it at that level. And also if you have things you want to share of your next steps on the ground, that's also very relevant. But I think community of practice might be an interesting discussion point. And the floor is open for those remaining. I don't see if anyone has a hand up. Please just unmute and. I mean, I'm curious as to what's going to happen with, you know, Global Water 2020 has convened this call. They've convened a lot of events in the past. Is there a community of practice that can build on what's happening now, and who can be a part of this, and how can it be housed? I think that's important to know, and the COVID dynamic is one aspect of that, but it goes much deeper. And like you were saying, Julie, we need to be in it for the long haul and really have and drive this forward with a flag raised. So that's a question that I have.
And I think, John, just, quickly responding to that as well. I think with Global Water 2020 sunsetting at the end of next month, we certainly look to those on this call. In terms of driving this momentum forward around cleaners, I think, it's just been wonderful hearing all the great work that's been done already around this issue around Washington healthcare facilities. There's certainly resources like WashingtonHCF.org, where I think a lot of this information can be housed. And just from taking notes during the discussion today, I think that there's a few points, that have been raised around messaging that could be developed, looking at targeting policymakers, looking at messaging that really looks, as Jennifer had mentioned, beyond emergency response, looking at how this can be integrated in the long run as good IPC, standards, good for AMR, quality of care, et cetera. And then I think the other point too that was raised beyond messaging was also to the need to ensure, I guess the implementation of it. And this was something I thought that Stephen had really good remarks around, was this gap in terms of implementation and how do we build upon these incentives that have been created already, by COVID and build perhaps upon some of these trainings like Teach Clean, et cetera. So I think those are just some of the areas that I picked up from this conversation, but would be keen to hear a little bit more, I think, in our final 3 or 4 minutes around those areas too.
Thanks, Kelly. One question that I had as well is, a lot of times we go into these facilities, we see that there is not a full set of tools and implements for doing the cleaning. The consumable materials are not there, the disinfectants and this. And there's a certain footprint that many facilities have in a country. We know that the surface area, we can measure what those are and the standard facility design. So would it be helpful to be talking about how much water is needed on an average basis per day or per type of service? What level of disinfectant is needed to clean those surfaces? Can we get a metric on that in every country or in every type of facility in every country, so that every management committee knows what they need to have and that they should be using that? There should be a certain burn rate or consume rate of those materials. So that's one thing we were looking at within the Swiss Water and Sanitation Consortium.
I want to agree with you, John. I think that guidance would really help. And even for advocates or community advisory groups that are attached to the health facilities, they will need to have that information so that at least they can be following up. It builds also into the budgeting process, because you find that one of the key issues that we've seen in Malawi, I don't know whether it's been raised, but the budgets for WASH are not singled out, where ring fenced, that's a word. So because of that, you find that it's a list on the priority when they are trying to procure things. But if we're able to show even the standards and what health facility needs, then it will be easier to be pushing and say, look, this is a standard for this facility, but we are at this level. These are the number of items that you need to have per month. For instance, if you are to meet all the demand for wash here, but you have only 2, what have you procured? So such kind of simple tool would really help. And I would really push to that, and it can work well for us like our organization, which works a lot on advocacy and making sure that we're empowering people to be able to speak up. But they need to speak with evidence and say, this is what you have done, but this is a standard. Yeah, over.
Thanks for that, Hester. I think we might have 45 more seconds. Anyone? Jennifer, I saw you had a hand. Anyone else? Jennifer?
Yeah, no, actually, I was going to say pretty much what Hester just mentioned, this idea that I think giving these kind of very technical tools that are able to provide that necessary data in order to feed down into local systems. And like I mentioned, we're doing results-based financing. And I think the business plans at the local level at each institution would greatly benefit from that kind of tool, because like Hester was saying, in order to establish a budget and be realistic in their purchasing and their planning, that would really feed into that. And I think in terms of responsibilization, really giving them that responsibility to say, this is what we need for the year and this is how we're going to meet our targets. Like you said, it's a back and forth. We have to give them responsibility and let them assume that role and that leadership, but also provide them the tools to do it.
Thanks, Jennifer. Thanks, everyone. We're going to close out in about 5 seconds, so see you back in the main room.
Hey, everyone. Welcome back. I hope that all of your discussions went really well. I know ours did. We almost could have used more time. So I'm going to quickly, Kelly Bridges and I are both the rapporteurs for both of the group. So Kelly, I'm going to let you present the slides first, and I'm going to share my screen so that everyone can see. During the sessions, Kelly and I actually just took quick notes on some slides, and we will just present we'll present them back to you. Can you all see this?
Haley, I think you have something else showing OneNote.
Whoops, that's the wrong one. Can you see this now?
Yep, just put it on, I think, full screen, and on question 2, it's right now showing question 3.
There we go.
Okay, great. So hi, everyone. As Haley mentioned, my name is Kelly Bridges. I am a senior associate with Global Water 2020. I do apologize in advance. I tried to capture all the really great discussion, in these 2 slides, and, apologize if I missed anything, but we'll look to others, in the group like John and others, to elaborate and add further if I've missed anything. But we were asked to address this first question about how has or will COVID-19 embed better environmental cleaning practices? How have you been, or how will you build upon that? And how has COVID-19 changed the dynamic? And I think we heard a lot of really interesting points throughout the discussion, looking at how COVID-19 has really created an incentive for ensuring and maintaining environmental cleanliness, whereas that sort of incentive didn't really exist pre-COVID, especially this greater focus on cleaners. So there are some really great examples that were raised, including in Haiti, where OneDrop has expanded the lens through which they have been examining Washington healthcare facility issues to not only look at quality of care, but also this healthcare facility safety in light of COVID, where I think these issues have really become paramount. And also looking at tools like results-based financing and social art for behavior change as ways to foster a culture of cleanliness. With results-based financing, there's opportunities to have institutional and personal incentives that can then be reinvested into local markets. And I thought that was really interesting to hear about that. We also heard from WHO about some of their work in EMRO with Professor Graham around the Teach Clean program, and how this has not only been a great opportunity to address IPC, but then also other issues that are important for COVID and beyond, including antimicrobial resistance, with a focus on maternity wards. And this is a way to, as well, to reflect the importance of cleaning staff through the various trainings delivered to healthcare workers, again, as to elevate their role, I think, within these healthcare facilities. And then just a final example too, was how Terra Dizome in Nepal have observed, because of COVID-19, a shift by the local government, whereas rather than the local government being pursued, the local government is now coming to TDH to ask them about how they can build the capacity of healthcare workers across the country through a master training, through other capacity building programs. And really showing the importance of WASH and IPC has, started to be institutionalized by these local governments. And then Haley, if you want to go to the next slide. So in terms of what's next, we discussed this as a community of practice, what could happen next, and certainly looking at ways in which messages should be developed for policymakers and other key actors, such as healthcare workers, to look at how do we institutionalize the prioritization of WASH and the prioritization of cleaners beyond COVID-19, and really make sure that these investments, as well as also behavior change, are maintained in the long run. We also discussed as well the need to bridge the gap between knowledge and implementation, as is being done by WHO and EMRO with Teach Clean. And looking at the need to develop a comprehensive training guide to support staff around environmental hygiene and healthcare facilities, and that currently doesn't, such a comprehensive training guide doesn't yet exist. So there's also a need to develop that. And I think the last point too, that I'll just mention is the need to bridge this gap in data. So we saw in the recent JMP that there was insufficient data around environmental cleaning. So the folks on the call were discussing ways in which to collect this data and to make sure that we have better data in the future for more powerful advocacy, and then also to ensure sustainability of WASH and IPC in these healthcare facilities. So I'll stop there, Haley.
Thanks, Kelly. All right, I will just briefly state which I think is this way. The two questions that our group we started with asking of the 12 actions. So there was an elevating the role of cleaners guidance note that we put out back in September that listed 12 actions that you can do to elevate the role of cleaners. And we focused on which have you or your organization focused on, and what are the next possible steps towards implementation. So within our group, we this is just kind of the tip of the iceberg, but we mentioned that there is no one thing that you can do to elevate the role of cleaners. A lot of the actions work combined together, integrated together. But we heard from Molly Patrick at the CDC that oftentimes there's a gap between these guidance actions and actually the active implementation. And so they are actually working and developing a toolkit to address that, and are piloting that in a few different areas. And thank you, Molly, for sharing that with us. We also raised that a system of accreditation would raise the standard of cleaners, raise their profile, provide a scheme for updating their role and their responsibilities, and would provide a formal acknowledgement to them as a profession. And then we also mentioned that perhaps as a community of practice, this is something that we can build on and work together moving forward at next events or next items that are happening. In addition to that, we talked about training and sensitization, that cleaners should be, that they should have hand washing, advocacy, policy development, and budget work. Essentially, if we, in Kenya, Haraf is working really to include cleaners and address this mismatch within policy development, implementation, and dissemination. And then lastly, they're working to bring these cleaners into the discussion and have them influence the budgets and really be part of that process. The next question was the same as your third question, the what's next. So how are you or your organization pushing this issue forward? Who do you see a champion in this space, and how can this best align within existing initiatives? We talked and had some specific examples, specifically from WaterAid. They are recently taking a deeper dive into environmental cleaning and are working to ensure both gender and social inclusion within that space. And they're also developing a piloting and life cycle costing tool, currently hopefully in Ethiopia, Zambia, and potentially Malawi. So that was exciting to hear, and we're looking forward to hearing the results of those studies as they come out. We heard from Harafa as well, and they're working to involve the community and policymakers in the budget making process, and essentially working to ensure that there is constant pay for cleaners, throughout that process as well. And then in addressing the who do you see as champions in this space, we talked a lot about how, we have this issue of the frontline workers that includes cleaners, but also largely includes nurses and midwives. And I think that's been brought out the most recently with this COVID pandemic. And we need to acknowledge not only cleaners, but the diversity of cleaners within this space, and how there are different cleaners within different diverse settings. And, they're all not lumped into the same cleaners, how we're phrasing it. And so really that the main champion should be nurses and midwives, but also cleaners as a united frontline workers. And then in addition, we were very happy to see that our breakout group had more health advocates than WASH advocates, which is something John mentioned on our group, which is very exciting to see, and that more champions in this space will have to come from the health sector in addition to the WASH sector. So I'm going to stop sharing my screen. Bear with me for 1 minute. Sorry, having difficulties not sharing my screen. There it is. Okay. So in closing, these slides I will make available following today's session, along with the recording. And I just want to thank everyone for coming today. It was a really rich discussion, and I'm excited to hear and read more about the other groups' discussions and conversations as well. In the next few days, hopefully today or tomorrow, I will be summarizing and putting together a document that summarizes not only Wendy's opening remarks and her slides, but also both of the discussions. I know our group had a few resource documents that we shared, so I will compile that all into an email and send that to you all, along with a recording of the session for those who either want to rewatch or want to share it with those who couldn't make it. And then lastly, as some of you know, Global Water 2020, we are an initiative, and we are ending on June 30th. We'll be sunsetting on that date. And we're very excited to see who will be rising up in this space as we move forward. We're really hoping that this community of practice is just the beginning in terms of building a more WASH and healthcare facility community of practice, focusing on environmental cleaning and cleaners, and that you will continue to join and be together. Sometime in the near future, I can hint towards this, and a more formalized announcement will be coming sooner, but a more formalized WASH and healthcare facility community of practice will be happening through Emory University. So please, keep an eye and ear open for announcements then. If we hear anything more, we will be sure to share it with you all, but as of right now, it's just a hint. And then additionally, what came up in our group is, moving forward, these next events that are happening, we know that the 74th World Health Assembly is happening next week, and we're really interested to see who, if you are attending that, bring up these conversations. How can we have this issue live there? And if you know of people, reach out to us. I think you have my email from the previous announcements, but I can pop it in the chat box as well if you have any ideas or how you would like to move forward, specifically at the World Health Assembly next week. Additionally, the people that convened this workshop also proposed and submitted a side event for the UNC Water and Health Conference this year, which hopefully will get accepted. And if it does, it would be wonderful to see all of you again at that event, continuing on this conversations. And in closing, thank you all for coming. Thank you for the speakers and the Jumpstart speakers. And if you have any questions or comments, I will just put my email in the chat. So thank you all, and look out for an email from me in the next few days. Thank you all for joining.
Thanks, Haley. Thanks. Bye.
Thanks so much, everyone.
Bye.
Thank you.
Thank you.